chromosomal abnormalities. Dr. Marty McCaffrey is a neonatologist visiting from the University of North Carolina to address Stormont about the issue, and he's with us in studio. Dr. Marty McCaffrey, you're welcome to the program.
They have done the care, which they fully recognize is very different than what they thought it would be. I think our goal is to build a society that can help support these folks.
Now, we have a big debate in Ireland about our Eighth Amendment, and there's a movement to repeal the Eighth because it gives the equal right to life to the child in the womb as it does to the mother. And the question of so-called fatal fetal abnormalities frequently comes up. Here we're talking about children who will possibly survive, certainly for weeks, if not months, if not a year, if not 10 years. But do you accept that there are some conditions which, diagnosed in utero, are incompatible with life and are truly fatal fetal abnormalities?
How do you define life?
Well, I'm talking about someone who has no brain, for example, who will never have any cognitive function. And
so you're talking about anencephaly babies. So I think that we don't know a lot about those babies. And if you're talking to me as a medical scientist, what do I think? I think what we realize with those babies, when those babies appear, they are not brain dead. They never qualify as brain dead. These are babies that do many things that normal babies do. Some of them actually try to eat and suck and are able to feed a little bit. So the question becomes, they're not brain dead. Is all of that just reflex, which is the popular thought? And I don't have evidence to totally dispel that. But there is some thought as well that even though you're missing the cerebral hemispheres, there are still neural structures there because all the hemispheres are not equally disappeared in these babies, that there is still some promulgation of some cortical activity. And you see that on pathology specimens when you look at these babies. So there's some element of consciousness there. I think when you talk to families who've had anencephalic babies, and we have looked at this in the U.S., where abortion is readily available in a very open environment, compared women who have had continuation of pregnancy, which those have terminated. And what Duke University has seen is that the women who go on to terminate have much higher scores for grief, much higher scores for depression, and much higher scores for post-traumatic stress syndrome, much higher difficulty coping after the loss of their baby. Universally, in the hundreds of families that I've worked with personally, not with anencephaly necessarily, but with a variety of these life-limiting conditions, I would dispel the language of fatal fetal malformations because honestly, Pat, if a baby is alive for 1 or 2 hours, for the family that had that baby, it was a life.
Yeah. Do you see any circumstance, therefore, in which a termination can be justified?
I'm not here to talk about my personal views about abortion.
No, but I'm just wondering if your medical view is informed by your personal view.
Well, I think there's obviously probably some impact of that, but the medical situation is clear that in the health of the mother, if you're trying to separate out the mother and her ability to cope, it is clear that psychologically and even health-wise, it is better for the mother to continue the pregnancy. That is not popular to talk about, but the medical evidence clearly substantiates that, and I would be happy to come on your show anytime, anywhere, and talk to anyone about evidence that would say, no, it's actually better for a mother in that situation to terminate the pregnancy.
So there is no circumstance in which you believe a termination is justified?
I believe if I am in favor of the health of women, so there isn't a case where I would say it's in your best interest to terminate this baby.
Dr. Marty McCaffrey, a neonatologist visiting from the University of North